I read your really interesting abstract on the relationship between cortisol response and the development of chronic pain in traumatically injured patients. And I had a couple questions for you. You mentioned in your abstract that this was a secondary analysis of a prospective observational study, but how did this idea for this particular analysis come about?
Yeah, so we did a prospective observational study on the study of trauma and resilience, really focusing on post-traumatic stress disorder and how it developed over time. What we really were focusing on is the endocannabinoid system, but we did do, we looked at other stress responses such as cortisol and some of the interleukin. And so when we do one study, one of my colleagues, Terry Cassini, who specializes in post-traumatic stress disorder, we always also look at pain, the development of pain, both acute and chronically, for longitudinal studies, because they are just so highly correlated. So that's why we did sort of the secondary analysis to look at how the stress response looked over time when you're looking at acute and chronic pain.
Excellent. So can you just briefly summarize your findings for this study?
Yeah, so when we looked at acute pain, we looked at primarily at the discharge pain scores and then 6-month pain scores. So there were just 2 points in time. And we did a awards analysis to look at like the clusters, so you could see the transition from acute to chronic pain. And we found these 2 significant clusters. Essentially, one, when you first, your pain is severe at discharge and it continues to be severe at 6 months. And then those people who had mild pain at discharge, and then it either completely resolved or was very mild. So we had those 2 clusters, and then looking at those 2 clusters, we looked at the level of cortisol, both acutely and then also at 6 months. And what we found is that those people who were not able to mount a cortisol response were actually more risk for the development of chronic pain. And we've actually seen that it's actually been identified in other places as well, where the mounting of the cortisol response seems to be much more protective. And I think what we're seeing is that those people, or why are certain people not mounting a cortisol response after an acute injury? And it seems that it's possible that it's because their system is burned out because they are highly stressed to begin with at the time of their injury. And therefore they can't mount a cortisol response. And the feedback loop is somehow dysfunctional. So when we were looking at maybe some of the reasons for that, we did look at minority status, and that seemed to come out as being one of those risk factors for the blunted cortisol response, and lack of social support.
And how about the cortisol patterns at 6-month follow-up? Did the same correlations persist long-term?
They were lower, yes, and it seemed to be not the natural response where initially you have the high cortisol and it comes down. It just seemed to be a very flat cortisol across the 6 months.
Okay. And how about accounting for differences in injury severity or even the presence of TBI? Because there have been some studies on cortisol response after traumatic brain injury.
Yeah, we did not recruit for more than a mild TBI, not less than a GCS of 13. But I'm sorry, what was the first part of your question? Oh, the injury severity
differences.
Yeah, and so actually in our studies, our previous studies, there's been no correlation between injury severity and the development of chronic pain, which is always interesting because that's the first thing everybody asks. And what we're seeing is that is it the injury that's the stressor, or is it the pain or the reaction to the pain, or how you're able to cope with it is the actual stressor? And so it actually, in this particular study, there did show just a very small correlation between injury severity and the development of chronic pain, which is otherwise has not been shown anywhere else.
Great. And was any thought given to following cortisol levels sort of longitudinally throughout the patient's hospitalization as opposed to two, finite fixed time points?
Yeah, because this was a secondary analysis of a study that was already completed, and it was primarily for PTSD, and really just trying to show a relationship between the endocannabinoid system and the other stress and the HPA axis using cortisol. We did not do multiple analyses. However, that is actually our next step. So this is going to be used as pilot data for an R01 to really identify how the cortisol is reacting over time, as well as the endocannabinoid system and how they react together, so that you can see more of a relationship, as opposed to, we know that it's probably not, as you are recovering, it's probably not straight across the recovery. There may be ups and downs, and it depends on what's happening during the recovery. Do they need further surgeries, or however their recovery is happening, do they have more psychological distress? Because sometimes those with PTSD don't necessarily have the symptoms immediately, and they'll have them later on down the line. So it'll be really interesting to see that change over time, but more points in time, to get a better understanding of how things change during recovery.
Perfect. And I sort of answered a little bit of my next question, but in terms of what future studies you anticipate will result from this analysis, and do you think that this is enough data for really, for patients or physicians rather, to change our practices? Do you think at some point that we'll start treating patients with low baseline cortisol levels and risk factors for chronic pain with steroids?
Yeah, that would be really interesting. I guess the question would be, do we want to treat them with steroids? Is that the place we go? Or is there somewhere else in the HPA axis that needs to be attenuated to change the dysfunction of the biology? I think we just don't know enough about the biology. And so I think we need lots of further studies to determine that as well.
Excellent. Well, thank you so much for taking the time to explain your research.
Thank you.
Thank you. I guess I probably should have asked you to introduce yourself at the beginning. I don't know if we could do that now. And
maybe they can edit it. Yeah, sorry about that. So I'm Colleen. I'm a nurse practitioner at the Medical College of Wisconsin. I've been here for 18 years. I'm a faculty member, and my interest is really understanding the transition from acute to chronic pain and trauma patients. I was sitting in conference one morning and was like, well, what is it that makes some people be more at risk for the development of chronic pain? Because it doesn't necessarily, and we kind of see that in our patient population, it's not necessarily related to how injured they are. And so that's kind of what brought me down this path of trying to look at the biology of what's happening, and then ultimately maybe identifying a pathway to attenuate that transition.
Great. Well, thank you again.
Yeah, thank you so much for your time.